Hello, this is Dr. David Greene, CEO of the Arizona Pain Network, where we bring you anything and everything educational for pain management. Today's topic is what you need to know about fibromyalgia. Well, what is it exactly? McGill's medical guide calls it a connective, soft tissue disease involving chronic, spontaneous, and widespread musculoskeletal pain, as well as recurrent fatigue and sleep disturbance. The condition presents as multiple tender spots on the body that are primarily found on the back, neck, chest, hips, arms, and legs. Previously, it's been referred to as multiple things such as fibrositis and psychogenic rheumatism. How common is it? Almost 3.5% of women in the U.S. have fibromyalgia and half of 1% of men. The typical age range is 30 to 50, and 3/4 of those who have it actually go undiagnosed. How do you know if you have it? The American College of Rheumatology has put out guidelines that state a history of several areas of aches or pain for a minimum of 3 months. You should have at least 11 of 18 locations on the body that are significantly tender, and you can see the 18 locations on these cartoons here around the neck, shoulders, elbows, knees, and then buttock area, and then up here around the back of the neck and the shoulder blades. And if it's close but not quite, it still has the same treatments, but it's called myofascial pain syndrome. So here's the JAMA guidelines from 1987, the Journal of American Medical Association. There's major and minor criteria. It's kind of a lot of text here, but basically most people don't use this when they use the American College of Rheumatology. Oftentimes fibromyalgia truly is a diagnosis of exclusion. A doctor will go through a differential diagnosis of all the things that it could be, run tests, physical exam, imaging studies if necessary, and if it doesn't quite fit, it becomes fibromyalgia. Well, what are the treatment options? There's a lot of alternative medicine options that have been shown to be helpful, such as acupuncture, chiropractic treatments. Physical therapy is more conventional, but it does help. Massage, aromatherapy, homeopathic medicines, spa baths, herbals, music therapy, and yoga. When you comes to medications, we'll talk about those FDA-approved ones in a moment, but there's antidepressant medications that can help, nonsteroidals, anti-inflammatories, muscle relaxers, acetaminophen, opiates, membrane-stabilizing drugs like Lyrica, sleeping aids, and then there's also IV infusion treatments such as Myers cocktail. There's 3 FDA-approved medications. In 2007, Lyrica became the first one, 2008, Cymbalta, and in 2009, Savella. Interestingly enough, we don't know how any of these 3 work, but we just know they do have a good benefit for those with fibro. And how well do they work? Well, the Myers cocktail had a pilot study done, and most subjects experienced relief as compared to baseline. They did not have statistically significant differences, but it had very promising treatment outcomes in that small study, so it's widely used today for fibro treatment. There really is not a cure. It's a very challenging condition. There are some new studies that showing patients can decrease symptoms dramatically through multimodality treatment. So it may be the Myers cocktail, it may be the medications, maybe some of the alternative treatments. Arizona Pain Specialists is the most comprehensive pain management in the Valley. They truly are a one-stop shop with acupuncture, medications, interventional treatments, chiropractic, spinal decompression. There are several locations. They're up to 6 now. They take over 50 insurances with the board-certified doctors. They have won the Patient's Choice Award 5 years in a row. The number to call for scheduling is 602-507-6550. And visit us on the web at preferredpaincenter.com. I'm Dr. David Greene with the Arizona Pain Network. Your pain stops here.